But tonight, we begin with a story that we've been tracking for weeks now. What exactly is the death toll in India's COVID fight? COVID 1.0 and 2.0. Now, today, these are the figures that have created a lot of alarm because suddenly the figures have crept up to 6,148 in the last 24 hours, the highest single day spike. Only yesterday it was 2,219. On May 18th, it was 4,529, the previous high. But there is a reason, a story behind the numbers that I want to lead with. Because as India records its highest death toll due to COVID in a day, the jump from 2,219 deaths to 6,148 came largely because of a revision of tally done by one state, the state of Bihar. An audit of the deaths by the Bihar government has found nearly 4,000 deaths that were not detected earlier. And once the revision came, the politics followed. But the question is Bihar alone? Is every Indian state undercounting, or some saying lying about its COVID death toll? It's our top story today.
A drastic revision from 5,500 to 9,429 deaths. A staggering 72% jump in Bihar's COVID death toll. The spurt came on Thursday as the Bihar Health Department added 3,951 unaccounted deaths in the state's COVID tally. The new figures came after an audit ordered by the Nitish Kumar government. The audit itself was the result of intense pressure from the Patna High Court over suspected undercounting of deaths in the state. Bihar's health minister was quick to defend the state government.
सरकार के स्तर से ये कहा गया है कि यदि किसी भी स्तर पे किसी व्यक्ति के द्वारा लापरवाही समझ में आएगी तो उस पर कार्रवाई भी होगी.
The opposition, however, is unsparing in their attack. The Congress has accused CM Nitish Kumar of lying to the people.
सरकार कह रही है कि 1200 लोग पटना में मौत के शिकार हुए कोरोना से 7 जून तक. फिर 8 जून को कह रहे हैं कि नहीं, ये 2200 है. तो ये जो आंकड़ों में हेराफेरी है, यह कहीं न कहीं बताता है कि सरकार ने इसे गंभीरता से नहीं लिया.
The RJD claims Nitish Kumar's double-engine government is thoroughly exposed.
सरकार पूरी तरह से एक्सपोज हो गई. पहले कोरोना जांच घोटाला हुआ पिछले बार, इस बार कोरोना से हुई मौत का घोटाला सामने आया है.
The ruling party on its part claims it was their government that ordered the audit and the High Court had no role to play.
लोग सरकार पर आरोप लगा रहे हैं कि सरकार ने मौत के आंकड़ों को छिपाया है. लेकिन ऑडिट कौन करवाता है? ऑडिट भी तो सरकार की तरफ से ही किया गया है. जांच टीमें बनाई गई हैं और प्रत्येक जिले में जांच हुई है, उसके बाद अनियमितता सामने आई है.
With the revision in Bihar's death toll, India for the first time since the pandemic started reported over 6,000 deaths, a grim new milestone.
There was always doubt that the Bihar government was under-reporting COVID death numbers, especially during the second wave, and it's only after the Patna High Court shared similar sentiments that the state government was compelled to conduct an audit in this entire matter, as a result of which overnight the death toll increased by almost a whopping 4,000. The opposition claims that this entire exercise to keep the numbers less was deliberate on the part of the state government and are now demanding a detailed investigation. With camera person Deepak Kumar, this is Rohit Singh in Patna for India Today.
My first guest tonight, Ajay Alok, the JDU leader and spokesperson, joins me from Patna. Dr. Alok, let's be very clear. Almost 4,000 additional COVID deaths now being reported by Bihar. Doesn't this expose the worst kept secret that states like Bihar were deliberately underreporting deaths for the last several months? That's the shocker that's come out today.
Well, Rajdeep, for the first time I am listening that here is one state in whole India which is changing its numbers on its own, which is conducting an audit district-wise, and then the state comes up themselves and they say, and a press conference is chaired by none less than a chief secretary rank officer, who is also the principal secretary health, and he says that no, There was deaths not 5,400, but there are deaths amounting to 9,200. And still there are 7,500 active cases in the hospital, and this number can go up. And we are also taking into account to give compensation to those who have died post-COVID because post-COVID complication, and still they have not been registered as COVID death. So all these things we are doing, and still you are saying that we have been exposed.
You
I
have
don't
been
think anyone in politics exposes themselves.
Dr.
You get exposed
Alok,
by others. But here is the government.
Dr.
Here is the
Alok-
government who's admitting that your death count has gone up.
Dr. Alok,
But in
I'll tell
whole
you
India,
why.
give me
I'll
example of one government who has said that
No,
death
no,
count
no.
has gone up.
Please don't take the moral high ground so easily, Dr. Alok, because the fact is, isn't it true that it is only after news channels like India Today showed how bodies were found floating in Buxar in Bihar that the High Court intervened, demanded an audit, and that your government woke up? You didn't audit the deaths accurately all these months. You cannot now suddenly say that the Nitish Kumar government is being transparent because you were not all these months. You woken up only after the High Court.
Well, let me tell you, the pandemic hit us in the last week of March and in the first week of April. And suddenly there was all chaos and there were all panic, and 75 to 80% of administration were busy in just preventing life, preventing infection. The death audits from different districts, yes, definitely they were delayed. So a committee was constituted, and there were 10 members in every district which went on and collected the data and submitted to the government. And still that work is going on. This work is not over. Rather, you should say today, Rajdeep, that all other states should take lessons from us, and they should come out with the exact numbers now.
Sir,
Because this death toll is rising, and it will rise for the next 2 months also. But none of the states are doing it. The question is not being raised for others,
I'm
but
happy.
the one who has exposed themselves, who have admitted that deaths have gone up. You are saying that we have been exposed.
No, in
It's other way
fact,
around.
Dr. Alok, this country at the moment is divided between states that are conducting audits and those that are not. Let's be honest, there are some states that have been conducting monthly audits and revising their numbers. But Bihar and Nitish Kumar, Dr. Alok, were going around claiming that your case fatality ratio, or Bihar's case fatality ratio was low, that COVID was completely under control, and they were pointing out to the low death figures. And therefore, now you've been exposed because of a high court ordering you to do an audit.
No. Many other states have done the audit, but see the difference in the audit report. The classical example where you are sitting right now, Delhi, the actual death certificate issued is 34,000 and the death report is 11,000. There's a difference of 21,000. Can you find that difference in Bihar? No. The death audit must be authentic. And the similar thing, where is Rajasthan? Where is Maharashtra? Where are other states who have done the audit? We have done it for ourselves. We have done it for ourselves. We don't need applause for that. No, it was nothing. There was no High Court order first.
There was a High Court order.
Thing, Rajdeep, there's a difference between order and there's a difference between observation. There has been no High Court order on that. None of the High Court told us to do an audit. On the
There was an observation.
Case, there was an observation from the High Court why there is a difference when we have 783 bodies coming up in the Ganga and you guys are showing only 69 bodies cremated. Why is the difference? That was an observation. That was not an order.
You know, Dr. Alok,
Bihar government is a responsible government and we are doing our job.
Dr. Alok, we can argue on semantics between an order and an observation, but let's just accept that many states, including your state, have hidden COVID numbers, and that's dangerous to hide the real numbers from the country. In fact, our reports from Bihar over the last several weeks have shown that in many districts, if a person dies at home because of suspected COVID, it doesn't get reported or gets reported in the death certificate as pneumonia or some other comorbidity. So actually, not only have you hidden numbers, but the fear that many have is your final death count in Bihar could be even higher than 72%, which is already being reported.
We have not hidden the number. Rather, we are the only state who has written to the center that even the RT-PCR report is negative, but the CT scan findings are positive. We are treating them like a COVID positive patient. So please pass on the guidelines. And the center is taking a look on that also. We are doing everything very scientifically. It's not, nothing is going unscientifically here. We are taking those numbers who have died of post-COVID complications. We are taking those numbers who have been testing RT-PCR negative, but still features of COVID. So everything is being accounted now. Every district is doing that. So I'm telling this is not the final number. This number can go up.
Okay, so you don't want to accept that the Bihar government has, in a way, deliberately carried out, as some are saying, a disinformation campaign, spread some kind of myths around its COVID functioning, dressed up numbers. You seem to be suggesting that all is well, that Bihar has COVID completely under control. Is that what you're saying?
Entire data account which was submitted by Bihar government yesterday is absolutely perfect data account, which have been assimilated over a period of last 20 days after doing audit. Still, one thing is left, that many private hospitals who have not updated their deaths on portal, they have been served with notice that please update your death portal within 48 hours, otherwise actions will be taken. Now, the heads will roll on those district officers who have delayed this data assimilation. So, as a responsible government, it's our responsibility to know how many deaths have occurred in our state and what best we can do for the third wave.
You know, but isn't all of this a reflection of the track record of the manner in which certain states are handling COVID? You know, it's all about propaganda rather than the reality. And states, including Bihar, now will be accused of being less than transparent with your numbers.
Never myth. There was never a myth created by Bihar government. Bihar government has been honest since the first wave. What we did, it in front of everyone. Bihar was the only state which distributed 1,500 rupees from its own pocket to all the migrant laborers who came here. Bihar was the only state that, other than the central grant, we distributed free rations. We have been honest and we have been transparent right from the beginning, from the first year and second year. And Bihar is the only state now who is admitting that in last 1.5 months, the death ratio has gone up by 3,400.
Well, let me only say this, Dr. Alok. What Bihar therefore then thinks today, by revising these numbers, I hope other states will also do so. It's time to get honest with data, because only then can we really prepare for a possible third wave and have public health implementation done in a proper manner. Thanks very much, Dr. Alok, for joining me there on Bihar's revised death data. Now,